Hey guys, it's Chandler, and welcome to the Healing Heroes.
I promise you.
I'm Chandler Stroud, an executive, wife, and busy mom of two, who after years of living with anxiety, health struggles, and an unshakable feeling like I should be happier, made a profound discovery that changed everything. Join me on a journey where unexpected paths lead to healing and more happiness. On this show, we'll explore unconventional ways to unlock more joy in your own life with the help of my very own healers and trusted advisors, the Healing Heroes. Hey everybody, welcome back to the Healing Heroes. I am so excited to have Karen back with us, my Myofascial Release therapist. And we had so much fun on our last episode together talking all things women's health. We decided to come back and dive in again, this time into the topic of menopause. Now, I am not quite at the phase of life yet where I am thinking about or worrying about menopause, but thanks to an uptick in conversations across a variety of mediums, I've learned a lot more about it as of late. And for those who aren't sure, menopause is simply the point at which women stop menstruating or stop getting their periods. And the average age for that is usually about 51 years old. But what's so interesting that I've learned just in recent months is that perimenopause, that period of transitioning into menopause, can happen 8 to 10 years out of menopause actually happening. So that would include me. I am in that window. And while I haven't noticed any clear visible signs of perimenopause yet, I know I'm on the brink, and many women out there I know are in this phase or in menopause or post-menopause at this point. So we thought it would be really helpful to talk to you guys today a little bit more about what those symptoms can look like and how myofascial release might be an option for you as you think about navigating some of those symptoms and how it can alleviate any of the discomfort that you might be in. And so that's the conversation we're going to have today. I will caveat, I am certainly not a doctor. Karen is not a doctor. We are coming at you from the perspective of two women who love talking about this stuff, and from the perspective of an expert in myofascial release and how MFR therapy can help you treat a number of not just physical ailments, but also a lot of that emotional distress that you might be carrying for whatever reason. And we'll touch on that today as well. I will say, if you are looking for more of a medical perspective on menopause, I cannot recommend highly enough listening to Dr. Mary Claire Haver. She has a website called The Pause Life and has been on a number of podcasts as of late. Mel Robbins, The Huberman Lab, Diary of a CEO, and just she's so inspirational, and I love her work and really breaks a lot of complex topics down in a way that are easy to understand. So I am going to go ahead and plug her and her work. She has a website, thepauselife.com, if you are interested in more of that medical perspective on menopause. But again, for today, I'm super excited to have Karen here, and we are going to talk about menopause symptoms and how myofascial release might be the tool in your toolkit that you are looking for to help manage and navigate some of the symptoms that you might be experiencing. So with that, and actually, I'll also say before we dive in, I always feel rejuvenated after I see Karen, whether I'm going to her and I'm feeling like I'm coming down with a cold, I'm extra tired, or just a bit sluggish from life. And she always makes me feel so much better. And I feel like I walk out of there with this new glow every time. And so I just, I believe in her, whether you're going through menopause or not, or you're just looking to relieve tension and stress or any sort of joint or muscle pain. She's just so good at what she does. And MFR has been such a huge part of my healing journey that I am very passionate about recommending it to all of you and building awareness, because I don't think it's talked about as much as it should be today. So with that, let me just quickly tell you all a little bit more about Karen in case you missed her intro in previous episodes. Her journey began as a modern jazz dancer and instructor until a terrible motorcycle accident changed the trajectory of her life. And as a result, she is now dedicated to helping others live pain-free existences and educating on the benefits of myofascial release, or MFR. Karen is both a licensed physical therapist assistant and licensed massage therapist. Ultimately, though, she became a student and expert instructor of the John F. Barnes MFR therapy, which she's now practiced for over 25 years. So you are with an expert today. She is so, again, awesome at what she does. I can't say enough good things about her. And I'm really excited to have you here talking about menopause, perimenopause, and the symptoms that often accompany both of those experiences for women.
Thank you, Chandler. It's great to be here again. This is definitely a topic that I think is misunderstood by a lot of women. And I'm really, really happy to see within the past, even 10 years, so much more information is coming to us. And it's through avenues like this. And for the doctors like Dr. Claire, who are willing to speak up and say, look, these things are normal, but this is what we can do to make it easier. And that's
Absolutely.
what this work will do as well. The myofascial release work will help calm some of the intensity of the symptoms that you may experience, because every woman is going to experience something a little bit different.
I'm so excited to dive in and tell women about all of that, because they might be experiencing symptoms that they don't realize could be associated with menopause as well. And I think that's especially true probably for perimenopausal women. If they're experiencing symptoms, even 6 to 8 years before they go through menopause, they're probably thinking, well, I'm too young for menopause. This can't be that. So I think it'll be really good to dive in and talk about that today.
Yeah, that's exactly right. There's so many symptoms that come upon us at the same time that it can be really confusing when you go to see your doctor and you've got a laundry list of things that all of a sudden you're starting to feel. And it's like, well, can we pinpoint this? Can we name this? And I think it's unfortunate that it's not brought together that, oh, these are all related to perimenopausal symptoms. And there are some things that can be done, and it doesn't have to immediately mean a medication. There are other ways to approach this.
And I think that's really important, because going back to even like the medical perspective, Dr. Haver talks about the benefits of lifestyle and some of those choices and behaviors alongside some of the medical intervention she also promotes in her research and in her work. So I think that's really important. And I'm excited to talk more today about the behavioral changes you can make day to day to help navigate and mitigate some of those symptoms.
That's true, because perimenopause is very sneaky. And like all of a sudden you can be hit with like 5 new things at once. Like, okay, that weight gain starts to creep up. All of a sudden you're not sleeping and you're like, why am I not sleeping? Stress levels can hit you differently. All of a sudden your body's achy and painful in certain areas. You're like, well, I never had pain there before. Or my shoulder's like, oh, how cranky is that? Like, why? I didn't do anything. So all of those things are just part of our hormones changing, and everyone's going to change differently. So, a doctor's going to look at your symptoms and say like, well, okay. But the big one I think that makes people and women more aware is the hot flashes. Like, everybody knows hot flashes are associated with this time of your life. But some people don't really get those as badly as others. So they're having all this other stuff happening to them and they're going, well, it can't be because I'm not getting hot flashes yet. Well, you don't necessarily have to have wicked hot flashes to be in it. So that was my experience. True. I had very little problem with hot flashes, but it was other things that I was just like, oh man, why am I feel like my whole body's aching everywhere?
Yeah, no. And I'm sure other women can relate to that. And yes. I really am excited to get in and talk all things MFR and how that can be a tool to support women who are experiencing these symptoms. But before we get there, I know many of our listeners maybe missed our first couple episodes together, Karen. Can we go back and just quickly explain the basics of myofascial release, starting with What is our fascia? Like in the human body, as we think of fascia, you and I have acknowledged it's not often talked about in doctor's appointments and online and in research. So I think good to just lay the foundation of what is the fascia in the human body and what is its role?
Okay, so I think the most important thing I could say first is fascia is the immediate environment of all of our cells, and it doesn't matter what type of cells they are, which means everything has to communicate. So our fascia helps everything to communicate. It's a tough connective tissue that runs like a web throughout our body from head to toe, continuous without interruption. And it surrounds and covers all of our organs. It keeps everything sliding and gliding and moving properly, and yet holding and containing everything where it should be. It's just a very fascinating fluid-filled system. And these networks are actually the first line of response to any disharmony or imbalance that comes into our body. So as soon as your hormones start to change, as soon as that estrogen dips, or as soon as the testosterone gets greater, or however your body is shifting, the fascial system is the first one to recognize that. And if you keep your fascial system open and just free of the restrictions that can get there from being injured, surgeries. For women, sometimes it's just the birthing process. Stress can cause restrictions. We tense our muscles. Our gut gets tight. People need to know that our fascial system supports our nutrition, our cellular respiration. There's just a list. Our elimination process, which can become a problem in menopause. Our metabolism, which can become a problem during menopause. Fluid and lymph flow, like swelling, our joints aching. So as you can see, it's nothing that you're going to experience that fascia doesn't have an effect on. My practice is mostly women, and I'm really happy and proud of that, because that was part of my mental goal when I began my journey into this work. I just kept getting continually led in that direction, because I feel sometimes women are just not served in the same way as we need to be, if we line up things with men, right down to, I know you mentioned Dr. Claire. She talks about how medications that are given to us during menopause, like cholesterol meds and those types of things, they're all tested on men. There's no studies showing what those drugs actually do for us. Our bodies will naturally start to make more cholesterol as we are entering into menopause. And part of that is to protect our brains. That brain fog. We need some cholesterol to keep our brain fog at bay. So we don't want to stifle that. So there's other ways, and to keep our body moving properly. And myofascial release is one of those ways to keep all those systems open and receiving things properly and distributing what needs to be distributed throughout our systems.
Well, that's what I was going to ask. So you did a good job explaining what fascia is and its role in the human body. But now specifically, as we talk about myofascial release, how does that work? Myofascial release. What does it do to the fascia to alleviate some of the things that you talked about, whether it's physical pain from a surgery or injury, or stress, emotional pain, things like that?
So we are trained to find points in our body where you are experiencing pain, but also following that a little bit deeper into your posture. During the initial assessment, you're standing, and we need to be able to see, as the therapist, as much of the tissue as you're allowed us to see. Meaning, if you can stand in a bikini in front of us, that's great, because your body has ways of showing us where there's lines of pull, how you're posturing, how you're standing, where there's actually restrictions that you can see on the surface that you may not notice as being a restriction, but it's a little tight, or that's a little hard. So the way we address that is using our hands and with different pressures and moving in different directions. And once you have the concept of how to approach working with fascia, hands on the body, it's up to the body to help show us what directions we need to go or where else we need to go in the body. It's really a feeling sense. Some of it is intuition. Some of it is feedback from the patient with the amount of pressure you have somewhere. Someone may report that where your hands are, say they're on your quadricep, they may report that, wow, I'm getting this sensation up in my left shoulder area, but that's really weird because how is that connected? Well, it's connected because wherever your fascial restrictions are webbing through your body, and I'll use this example over and over again, like a sweater that has been knitted. If you pull the string in one place, other places distant from where you're pulling are going to tighten up because it's all encompassed as one. So you can have fascial restrictions far away from any site of the beginning of a fascial restriction. Another way to look at it is if there's places in your body that feel like beef jerky, they're dry and hard and actually, in essence, truly brittle, even though they're inside you. We are taught to work with those areas to bring back and open up the tissue and have all the ability of the energy and the nutrition through our blood and oxygen getting back in there and rehydrating and opening up the tissue. And muscle and fascia has memory. So it knows it should be open and soft, but over time it could get kind of, cranky and tight. So as we're working either directly on the area or distant, we can get it to relax and open. And that's where this work is a little more permanent for sure in many ways versus just going for a massage. And it's not a symmetrical way of working with the body because what I do on that right quad where we found that knot, I'm not going to go to the left side if there's no problem there or it's not connected in some way. So it's not every side you're going to come in and each side that I touch is going to get touched on the other side.
Yeah.
It's following that rope.
I love that. And actually, it's so true, guys. I mean, this is the difference between MFR and like a massage, right? It's a very different type of practice. There are days that I come in and it's very gentle and I feel very relaxed and that we've had a massage and I'm rejuvenated at the end. And then there are days where you really dig in and I sit in that discomfort for however many minutes you feel you need to be in there for it to go away. And it's not symmetrical. I mean, you've definitely done work on the right side and then left the left. It hasn't been an issue. So I think that's an important point for people to hear so that they understand that we're not talking about, a Swedish massage. This is something very different that is targeted and custom to your body and what you need. Thanks for that explanation, Karen. That's super helpful. And I think as we think about how this starts to relate to menopause and the symptoms women are navigating, I'm first curious, what are some of the primary physical symptoms of menopause that you feel like myofascial release can help alleviate or treat?
Okay, so it will alleviate and treat all of the symptoms, but the top 4.
Okay, we'll go. I love it. What are the top 4?
The top 4 of women who come through my door are brain fog.
Okay.
Hot flashes, which is like, I think the big trigger I talked about earlier. Yep. Sleep disruptions.
Oh, that's a big one.
And the weight gain. It's like all of a sudden my waist disappeared. All of a sudden I have a belly. All of a sudden, I'm like, my arms are being wiggly. Like
bingo wings.
Yeah, our tissue, it changes. So those are definitely the top ones. And all of these fall into perimenopause to the point even after you have stopped your cycle, because now your body's struggling because it doesn't have all the hormones that we need in balance because they're just not there anymore. Our ovaries just have so much they can give and then it stops. So this is where joint pain, the more all over body type of pain will start to hit you. Like inflammation in places you never had it before, arthritis. Of course, your cycles are going to fluctuate from very light to like almost hemorrhaging heavy.
Whoa.
It can really fluctuate so much. But I think those are the biggest points in what I have seen come through the door. But migraine headaches, there's everyone will deal with things differently. How they're dealing with stress. All of a sudden, they're like, oh my God, I feel like a mad woman. I just want to scream at everybody. Or my temper is very short and I've never been that way before.
Mood. I would imagine your mood absolutely changes. It changes for me every month when I'm around that time. So I can't imagine when you're going through a major
PMS
change
on
like
steroids.
that. Yeah.
Yeah,
mood,
steroids.
Guys. Oof.
So, so some of it's like, oh, okay, we've had some of this and now it's just things just they just become tenfold. So again, every approach, every person that I work with is going to be a little different because we're all individuals. It's not a cookie cutter, oh, we're going to all do the same thing, because that's not for everyone. Some people may need to pay more attention to their nutrition. Some people may need to pay attention to moving more, just simply moving more, going for a walk. Maybe not having the glass of wine in the evening with your dinner, because alcohol will really wreck you as far as your symptoms. It just inflames the symptoms in this incredible way. It's just very prominent in what I've seen across the board, no matter who you are. So that's like one common denominator I could say is there all the time. And of course, if you're not sleeping well, what else? That just affects all of the
everything.
Things. Your inflammation, you're not going to want to eat right. You're going to want the junk. You're going to want the caffeine, things that can affect us in a negative way.
Since you referenced sleep, Karen, I've heard it can be very difficult to sleep when women go through menopause. I know that that's one of the primary symptoms and one that is one of the more challenging ones to navigate and cope with, I'd imagine. How can MFR help women overcome sleep disturbances they might be experiencing? I'm curious how that works.
So first of all, getting treatment, because again, that's just going to help to kind of level out all of your systems internally, communicating in a better way, releasing restrictions. Also, just taking that time out for yourself to be still and doing something for yourself. Being on that table is part of you taking care of you. And we're not used to doing that, especially when we're coming into this time of our life. A lot of us have children or ailing parents, full-time stressful jobs. We have so much to handle that when you take an hour of time out for yourself just to help yourself to heal is an amazing situation to start it all off, so that you can go home in a better, more balanced state of being, so that you can rest more.
I would imagine it's easier to achieve that state again later in the day. Like if you've had treatment earlier in the day and then you go home at the end of the day when you're trying to kind of wind down for bedtime. It's like you've already been in that restful state earlier in the afternoon on the table. I'd imagine it's easier to access that potentially for some women.
Everyone's different. People are morning people. Some people are night owls.
Fair.
I just find that because the results of what you will get in the treatment are more lasting.
Okay.
And then I'm also going to kind of navigate through all of the other things. Okay, so where can we tweak nutrition? Where can we tweak? Maybe you shouldn't be sitting with your computer on your lap in your bed right before bedtime. Just taking away that blue light or that other stuff that can be excitatory at bedtime. There's other exercise, movement. There's so many different things. And because it's so individual, I'm going to tell each person differently. Sometimes it's just a matter of drink some warm water when you first wake up. Drink some warm water. Drink as much warm water as you can. That helps us flush our system. It's gentle on our body. Our stomachs really don't want ice cold anything first thing in the morning, but yet we'll eat that cold cereal. Or, there's just different things that can be helpful that are, you're not necessarily going to be told. Yeah, lifestyle. You're not going to be told by your doctor.
How do you think MFR is a unique solution for women experiencing menopausal symptoms versus other treatment options that they might consider?
Okay, this is a great question, because when you come in for a myofascial release treatment, either with me or another therapist anywhere across the country, We are trained to look at your whole body, your whole person. So that's including physical, mental, emotional, spiritual, everything, family unit. You're treated individually. And that in itself, oftentimes with women more so than men, it's a sense of taking your power back, because now you're here, you're taking the time, you're going to, put yourself in this situation so you can get better. And you open yourself up to really exposing yourself for healing is the best way I can put it. So we're not just going to touch the part that hurts. We're going to have some dialogue. We're going to maybe be quiet the whole time. But the point is that every part of you is going to benefit from what we do. And that goes back to all the emotional things that can come up. We talk about those things. We go through those things. There's no stone left unturned in some of my sessions. And it's a safe place for people to come to heal, because healing is more than one system. Everything is integrated. And through myofascial release and the way we are trained, that's what we're here to do, is to help all of your systems work in harmony. The person who is placing their hands on you, there is an energetic connection that's undeniable, that really makes a difference than sitting across from a table, sitting on telehealth, or sitting across the room from each other. When you have physical contact with a person, it just opens different doors. It's a way in, getting into those places that have been injured or hurt or are just out of place. Structural work is obviously part of what we're doing, but the soft tissue is what's helping the structure change. We're not going in there and moving the bones on purpose so that everything around it has to adjust. It's going in and working with the soft parts of you, the tissue, the muscles, the organs. And when they open up, the bones will go back where they need to go. There's also a mindset, the things that, like we're talking about, that things we're holding on in our head. Sometimes belief systems will prevent us from getting well until someone is taking the time to help you realize that what might be stuck here is coming from something that keeps playing in your head. Some old tape recording of you're not good enough, you're whatever the voice is saying to you. There's so many ways to take this context and work with it with the physical body. So MFR differs from massage therapy in general because the effects last longer, because we're affecting the ground substance in the fluid of the fascial system. And that's a very basic answer. You can look into the science of it if you wish to, but it's all fluid-filled microtubules. And massage therapy kind of will go over the surface of things, or they work so hard and go so deep that your body is now shutting down because it feels like it has to protect itself because there's so much force being put through an area that your body actually goes into a protective response versus allowing itself to stay soft and open and receiving the energy and the pressures that are put on it. So yeah, it goes back to it's fluid in there. And a restriction is when that fluid, the fluidity has been compromised and it starts to become like that beef jerky. You don't have to get in there and just like harshly try to open that. Is that necessary? I could say rarely with myofascial release work if you're doing it correctly. So it's the fluid filled part, and that will last because you're not forcing the body to do something that it's not supposed to do. So your body knows that. Your body knows, oh yes, we're supposed to be this way. We're supposed to have fluid. We're supposed to have this fresh blood flow and oxygen coming into it without being forced to be there. Because if you force anything, it's just going to retract.
Yeah. Yeah. And I think that's really interesting because I do think in regular massages, the pressure and to your point, everything's symmetrical and the pressure tends to be the same. You know, they say, is this pressure good? And then they stay at that pressure level throughout your treatment.
Right.
Whereas MFR, sometimes you are in there going deep, loosening knots, and I'm like, ow, ow, ow. And then other times you're using, like, I barely feel your hands on my body, and it changes the scope and spectrum of touch, and the pressures that you use are so different and are so specific to an area or objective that you are trying to achieve. And I think that's a really good point to make about as we think about the difference between MFR and just getting a Swedish massage. They really are different, not just the pressures and the effects, but the lasting effect of MFR on the body.
Right. I often will say, think about a water balloon, and if you press gently, you'll see it move and change.
Cool.
If you press really hard, it's going to pop because you want things to expand. You don't want them to pop. You don't want them to tear again because now you're causing more scar tissue for them to repair.
Totally.
So
that makes so much sense.
You wash, rinse, repeat. That's not what you want to repeat. You want to wash, rinse, and be, whoa.
Yeah.
Beautiful.
I think one thing that sets MFR apart from a lot of other treatment options is that it is healing the physical body and the physical symptoms of perimenopause, menopause, postmenopause. But to your point, also the emotional ones, right?
Yes.
Like brain fog and hot flashes, for example, or sleep disturbances aren't necessarily like a hurt hip or a sore leg.
Correct.
But MFR can help with that. It's also addressing whatever other symptoms that may feel more, I don't want to call them mental, but like other symptoms that feel a little bit more cognitive or less tangible might be the word, right?
Because your subconscious is holding this. You're not even aware sometimes of the messages that are in there.
And menopause is so much more than a somatic experience. Yes, it starts there, but I think there are so many emotional elements of going through menopause that women don't really know it's okay to talk about, I think. And
there's a grieving process. There really is a grieving process.
I think there is a grieving process.
Yeah, because we're the life givers, and that's part of us that's no longer an option for us to have. So there are especially women who are struggling with conceiving to begin with. So yeah, there's so much emotion behind a lot of what we go through. Even breast tissue. Breast tissue is very sensitive, and there's so much emotion comes up for many reasons when working with breast tissue.
To that point, Karen, can you share any stories of women who have sought your help to address any of menopausal, perimenopausal, or even postmenopausal symptoms that they might be trying to navigate on their own?
Okay, so there is a person who comes to mind who was coming in with increased like headache, brain fog, migraine type things, some dizziness. And as I was treating her menopausal symptoms over months started to increase. There was the waking, which was one of the first things she started to complain to me about, was like, I don't know why all of a sudden I'm putting on all this weight. And then the hot flashes were right there to follow, you know, and then the sleep stuff. So as we were working and, you know, through dialoguing, through getting to know her better, she came to this awareness through my kind of prompting her, through the body work, through everything we were doing. She started to realize that she had a lot more stress than she wished she had at work, because the first thing was, it's not that she wasn't doing her job or not, you know, doing a good job at what she was doing. She never really wanted the job to begin with. She was just doing this, and that followed her story back to her parents kind of forcing her to go into this field that she never really even wanted to go into. And she started to think for herself that, wow, I haven't even really been in control of my own life. And through the myofascial release work and just putting pieces together, part of my job is to empower you to help yourself heal, because I am the person that's going to assist you on your healing journey. This is your journey, and you can choose to take it wherever you need to take it. And she chose to want to explore more and deeper. And the deeper we went with bringing up the emotions and the situations that she felt squashed her, she started to heal. Her symptoms started to get better. She left that job. She became more of the person she was authentically inside of herself, knowing who she wanted to be. And as a result, a lot of those shifts that were more intense calmed down. The hot flashes became less often. They became less intense. Her weight gain started to shift. And I just said, you need to be patient with yourself, because your body has to go through this entire process before you're going to come back to an equilibrium with it. And then you can really focus on working on different things. So we just kept going with what was working. And it's going to be a little different for each person. But definitely, she got her power back and her healing journey shifted. But it wouldn't have done that if she didn't have the whole process of MFR, hands-on, me listening and taking into consideration what she was saying and feeding it back to her in a way that she could come to her own realization.
I love that so much, Karen, because I do really believe the first step in healing is becoming aware of your emotions, what's going on inside, how you feel. And a lot of the approaches we talk about on this show are meant to help you get more curious about yourself, which you helped this woman do, and you helped her process all of those feelings on the table and off in some ways. And I think that's really powerful, this concept of empowering women to heal themselves, but they can't heal if they don't know they need to. And I think that's what MFR and many of the other things we talk about do, is that, again, it helps you become curious so you know what's there. And then it's up to you if you want to address it or not, and how.
Right. And I think part of that comes from just in general in our society, we've become so used to go to the doctor, do what the doctor says, don't question the doctor, take the medicine. It's a process that we give our power away when we don't ask questions, when we aren't curious about, well, why would I have to take that medicine if I can do this instead? I mean, it's just helping people come to that realization that you have more healing ability inside of you than you're giving yourself credit for. We all have the potential. People have healed cancers in themselves. I have helped people to get through those situations that were just big mountains, and they had the willingness and the openness to receiving whatever it took to get to where their endpoint was. We all need encouragement for that. We all need, someone to help bring that awareness to our own being.
That's what we're doing here, Karen. That is what we are doing on this show, guys. We are here to help bring awareness.
Yes, but you're bringing awareness to your own self that this is your journey. Don't give it to anyone else. Don't let them say, no, you can't do that, or, oh, what's that about? You don't need those types of energies in your life. You don't need those types of messages coming to you, because you can do amazing things when you are all in to change.
You guys heard it from Karen here first. You guys could do hard things, especially when you set your mind to it. So I think that's the perfect note to end on. There's so much more we could talk about. So very possible we come back and do a part 2 on this, since I have so many questions that I didn't get to ask, but we are at time. And I'm so grateful for you, Karen, and the work you continue to do. And also just for being here today and sharing your wisdom and experiences with all of our listeners. I know I certainly appreciate it. And I'm sure so many women listening also appreciate knowing you and hearing more from you and your experiences. So thank you for being with us today, Karen. Really appreciate it.
You're welcome. It's always my pleasure to help anyone seeking how to manage their healing journey. It's a blessing to me to do this work, and I appreciate you and your efforts to put all of this out there.
Thanks, Karen. And if you guys liked what you heard today, please share it with friends and don't forget to follow us. You can also visit healingheroespodcast.com to get resources, meet the heroes, and share your ideas for future episodes. Thanks for listening, everyone. And until next time, remember, be curious, be courageous, and be kind to yourself. You've got this.
Gonna make it through.